All right, we are going to get started with today's Medicare workshop, Medicare webinar. Happy to be here and happy for everyone to join today's workshop. And thanks to Lynn, who's your group broker on your group health benefits for Sabre Systems. This is going to be a purely educational webinar on Medicare. I understand there's a lot of questions that come up. Generally, a lot of people working past the age of 65. We always get the question, do I have to do something at age 65? And we're certainly going to hit that in today's presentation today. I like to kind of hit that right off the bat, though, because I know people are anxious. And if you're working at a company with more than 20 employees like Sabre, you don't have to do anything with Medicare when you turn 65. We're going to get into a lot more detail in the workshop, but I always like to hit that right off the bat, because I think people are just concerned, about turning 65 and do I have to do something? So we're going to get into that in today's presentation. Just a quick introduction into who we are, though. Senior Advisors, we are a general agency for Medicare planning. And to give you the background, it's my father's business, who you see his picture here, Doug Lubinow. He's been in the insurance industry about 30 years. He started out in small group benefits, and he never really had a solution for Medicare. And he would tell people just to call AARP or call Blue Cross when they turned 65. And about 15 years ago, he got educated on Medicare. One of his close friends got him started, and he's actually built Senior Advisors as one of the largest general agencies in the Northeast for Medicare planning. So we're also very actively involved in our association, the National Association of Health Underwriters. I've been on the Medicare Advisory Board since 2016. So we lobby on behalf of Medicare beneficiaries. We go to Washington, D.C. every year. I've met with the House Ways and Means Committee several times, as well as individual representatives down in Washington related to specific Medicare issues. So I'm very actively involved there as well. If you hit the next slide, Rod. We have over 25,000 Medicare clients, mostly in the Northeast. New Jersey, Pennsylvania, New York, but all over the country. You'll see in the next few slides here, we're licensed in over 30 states as well. Our two offices, we have one in North Jersey, which is where I am, in Cranford, and my father's office down in South Jersey, down in Moorestown. And we also have an office out in Arizona, in Phoenix, as well. I mentioned we're licensed in a bunch of states, almost all over the country. We continue to add new states every year as people retire to certain states, or we get referrals in other states. So this map continues to fill up and will continue to fill up as we continue to grow. What do? We really focus on the education. As you're going to see in today's presentation, that's really what's important with Medicare. It's a very complicated, complex topic. And we're going to do a webinar today that just breaks it down for you, tries to simplify it as best we can in 60 to 90 minutes here for today's presentation. Once folks are ready to enroll, we assist them with the enrollment. So we are not captive to a particular insurance company. We're essentially a broker for all the A-rated insurance companies. So we help folks enroll in the right coverage when the time is right for Medicare. There's no fee to work with us. We're basically, like I said, a broker. So you pay the same premium, whether you go directly to the insurance company or if you work with a broker for your Medicare planning. So there's no cost to you or your friends or family to work with us for their Medicare planning. And then we assist with the actual enrollment, whether it's enrolling in Part A and B, the Medicare Supplement or Medicare Advantage plan, if you decide. We help with that piece of the puzzle. So that's just a little bit of background. We just like to set the foundation or the framework before we actually jump into the presentation. The Medicare webinar is broken into 3 sections. So the first section is kind of your Medicare 101. It's going to go into the different parts of Medicare, how much you pay the government for Medicare Part B premiums. If you're in a higher income bracket, we're going to get into those. They're called IRMAAs, or income-related monthly adjustment amounts. We're going to get into when you should be signing up for Medicare, how you sign up for Medicare. If you're working past age 65, we're going to get into more detail on those scenarios. And also the differences between Medicare supplements and Medicare Advantage plans, which is 2 very different ways to get your Medicare coverage. So that's all going to be captured in that first section of the presentation. The second section is the prescription drug plans, which can be one of the more confusing parts of Medicare. We're going to break that down for you and try and give you the framework so you understand how Part D of Medicare works. You may have heard of the Part D donut hole. We're going to explain how that works in Section 2 as well. There's one other piece we've added into Section 2, which if you hit the cursor, Rod, is the Inflation Reduction Act. So this was a bill that was passed about a couple months ago, a month and a half ago. And there's some impacts in there as it relates to the Medicare prescription drug pricing over the next several years. So we're going to get to that as well in Section 2. And then at the end of the presentation, we just recap the top 5 mistakes people make on Medicare. So these are going to be highlighted in Sections 1 and 2. And then at the end, we just kind of recap those mistakes. One thing I will say before we kind of jump in here, if you do have any questions, please use the Q&A function in Zoom. It should be either at the bottom or the top of your window, depending on how you've got things configured. Not the chat window, use the Q&A window. You can just type your questions in there. We will try to get to those questions throughout the presentation. So, we won't wait till the end. Feel free to ask those as they come up and we'll address them as we can. Go ahead, next one, Rod. Okay, so this is just very high level. What are those parts of Medicare? So Part A of Medicare is going to be the hospital benefit. So this is if you're an inpatient in the hospital. It's also going to cover if you get transferred from the hospital into a skilled nursing facility. Okay, this is like a rehab facility. It's not long-term care. It's not assisted living. It's rehab. So you've had a knee replacement and you're in the hospital for a few days, and then you get transferred from the hospital into a rehab facility. That's under Part A of Medicare. You had a stroke and you're in the hospital for a few days and you get transferred into the rehab. That's under Part A of Medicare. All right. Part B of Medicare is going to be pretty much everything outside of the hospital. Your doctor's visits, specialist testing, x-rays, CAT scans, expensive things like chemotherapy, kidney dialysis, infusion therapies. That's all under that Part B umbrella, all right? Part C of Medicare, this is a bit of a misnomer. It's not really a part of Medicare, but it's another way for you to take your Medicare benefits. And it's also known as a Medicare Advantage plan, which is the fully privatized option where the insurance company takes over and fully manages your benefits for you. So it's a very different type of coverage. We're going to explain later on in the presentation. Rod's going to give us a great explanation of some of the key differences between Medicare Advantage and Original Medicare. So we're going to get into that. And then Part D of Medicare is the prescription drug coverage. There's about 25 different Part D plans available in each state. If we have time today, we're going to do a live demonstration of the tool that we use to pick the most cost-effective Part D prescription drug plan for each individual. All right. Now, each of these parts has a premium or not associated with it, which you see at the bottom of the slide. Part A for most people is going to be no additional premium. And I say additional because as long as you've worked 40 quarters and contributed to Medicare and Social Security tax, which is basically 10 years, then you don't have to pay any additional premium for Part A. For the people that don't meet that criteria, it's actually very expensive. Part A can be like $500 a month for that hospital coverage. But again, most people meet that criteria, so there's no premium for those folks. Part B of Medicare, these are next year's numbers. So the numbers actually came down slightly for 2023, which is unusual. But the premium for next year is starting at $164.90 a month for the Part B. When we get to the next slide, you'll see that this is income adjusted. If you're single income above $97,000 or joint income above $194,000, you're going to pay more to the government for those premiums. Part C premiums, this is that Advantage plan. Again, those are going to vary depending on the Advantage plan you enroll in. We do not get into specific Medicare Advantage plans in this presentation, but just know that the premiums can be as low as $0 a month on the Part C and as high as over $200 a month we've seen on these Advantage plans. Most people, if they're enrolling in an Advantage plan, are going with one of those zero premium Advantage plans. Keep in mind, you still have to pay the Part B premium and any sort of income adjustments if you decide to enroll in that Medicare Advantage plan. And then the Part D, as in drugs, those premiums are going to range anywhere from roughly $6 or $7 a month, all the way up over $100 a month for the prescription drug coverage. It's also going to be income adjusted, which we'll explain in the next couple of slides. So this chart here shows us those income adjustments for the Part B premiums. Okay, remember I said the base amount is the $164.90 per month for next year. We're going to focus on the right side of this table. The left side shows us 2022, which is, we only have a couple of months left. So we'll focus on the right side. The 2023 base is $164.90 if you're single income below $97,000, joint below $194,000. But you can see if you happen to be in a higher income bracket, you're going to pay either $230 a month, $329, all the way up over $500 a month if you happen to be in one of those top income brackets. All right, so that's what you have to pay the government for the Part B, as in boy, premium, and the IRMAA, income-related monthly adjustment amount for Part B. Now, there's also an IRMAA on Part D, as in drugs, which is on the next slide. And it's going to be the same income brackets that we see for the Part B. Might be delayed, Rod. I don't know if you can go to the next slide. There we go. So the same income brackets you see here. So if you're in that base income bracket, you're not going to pay an IRMAA for Part B or Part D. But if you're in one of the higher income brackets, you have an IRMAA for B as in boy, as well as D as in drug. So you'll see like this second income bracket for next year, you're not only going to pay your plan premium, but you're also going to pay a $12.20 IRMAA to the government every month because you're in the higher income bracket. So you pay the premium for the drug plan to the insurance company that you get the drug coverage from, but then you pay the government an IRMAA for being in a higher income bracket on the drug plan, as well as the Part B, which we just went through. And then the next slide, all we've done on this last slide here on the premiums, we just summed up those numbers. So you could see if you happen to be in one of these higher income brackets, how much you're paying the government. Again, the base amount is still $164.90, but if you happen to be in the second income bracket, your total would be $243 per month per person. If you're in the third bracket, $361, and all the way up over $600 a month. If you're fortunate enough to be in that sixth or top income bracket, that's what you would pay the government. We do have a question that, will the slides be available? Yes, we'll send out after the presentation, we'll send out those slides. So these are those, if we could just jump back real quick. So this is the total amount you pay if you're in one of these higher income brackets. What income is being used to determine these premiums? Well, the government's using it's called modified adjusted gross income, which for most people is going to be the same as your AGI or your adjusted gross income, but they're using the last tax return they process. It's the best they can do, right? They don't know your current income. They know, for example, at the end of this year, when they're figuring out the 2023 premiums, the last tax return they have is 2021. So they're using the 2021 tax return to determine the 2023 premiums and IRMAAs. They realize this is a flawed system, but it's the best they can do. So they allow you to appeal these IRMAAs. If you've had a life event since the 2021 income, you've retired, or these are a list of the life events on this appeal form, SSA 44. Work stoppage and work reduction are the two most common that we see. You would check off on this form that you had a work, after you get the IRMAA letter is when you do this appeal. So you receive the IRMAA letter, they tell you got to pay all this extra amount, and you say, wait, I've retired, I'm not going to be in that income bracket anymore. You check off work stoppage, the date of the work stoppage, and then there's another section of this form where you put your projected income now that you're retired. And the government basically just takes your word for it, and they reduce down to the correct income tier based upon your projected income. So we highly recommend this appeal process if you are no longer going to be in that income bracket due to one of these life events. Okay, if there's any questions on any of the premiums or the IRMAAs that we just went through, or the appeal, just type those in the Q&A window, and we'll be happy to address those throughout. Okay, so when do you sign up for Medicare? Well, the Medicare system was built over 50 years ago, and most people were retiring at age 65 at that time, or even earlier. And so they built this initial enrollment period, IEP, around the 65th birthday. So for people that don't have other credible coverage, which you have if you're covered on the Sabre Systems health plan, but for folks that aren't, for example, they would have to apply during this 7-month window. It's the month you turn 65, 3 months before your birthday, and 3 months after your birthday. That's the 7-month initial enrollment period. You can enroll as early as 3 months before. So in this example, if your birthday is September 10th, your eligibility or effective date would be September 1st, but you can enroll as early as 3 months before, June 1st, and you will get that September 1st effective date. All right. If you miss this window and you don't have other credible coverage, you're not covered under, the Sabre system plan, for example, and you just don't have any health insurance, and then 2 years later you go to sign up for Medicare, there will be penalties and delays. Okay, that's there for those folks that don't have any coverage or any credible coverage. There is penalties and delays, but if you're covered on the large group health plan, you don't have to worry about that, because you can sign up in the future when you leave the health plan, which we're going to talk about shortly. So we could skip over this one. This one's going away. Skip over this one too, right? Okay, so this slide here shows us this is what's important. If you're covered on a group health plan, there's federal law that determines, it's called the Medicare Secondary Payer Rules, that determines which insurance is going to pay your claims first. And if you are covered on a small group health plan with less than 20 employees, so for example, if you're covered maybe on a spouse's health plan at their employer, and it's a small company with less than 20 employees, then Medicare is primary, which means you would have to sign up for Medicare because Medicare A and B need to be there as your primary insurance. And then that group insurance for the small company would essentially become secondary to Medicare. That's the first row of this table. Again, if you're covered on Sabre, that's not the first row. That would be the second row, which is employer has 20 or more employees. In this example, the group health plan will pay first, which means you don't have to do anything with Medicare. You can stay covered on the group health plan as long as you continue to work. There will not be any penalties or delays in your Medicare coverage if you stay covered on the group health plan. All right. There's a lot of confusion. You're probably getting mailers if you're turning 65, around 65, phone calls, people scaring you saying, oh, you're going to be penalized. If you're covered on the large group plan, you're not going to be penalized or delayed in your Medicare coverage. Okay. Now, that doesn't mean you have to stay on the group health plan, right? It's your decision. You've paid into the system your entire life. You can do a comparison. We can help you with a comparison if you'd like to say, this is what you're paying monthly out of your paycheck. This is what the coverage is like. If I go get Medicare, what's that going to cost me? And what is the coverage going to look like? Does it make sense for me to stay on the group health plan or go get Medicare? Okay, that's your option. Since you've paid into the system, you can go get Medicare if you choose to in that second row. All right. The third and fourth rows of this table are just for a slight nuance on these secondary payer rules. If you qualify, you can qualify for Medicare when you turn 65, which is the most common way, but you can also qualify if you're on disability for 24 months. So if you're on Social Security disability, you might be 35 years old, you're on for 24 months, you can qualify for Medicare. And the secondary payer rules are a little bit different. Then if it looks at a company less than 100 employees where Medicare is primary, and more than 100, the group health plan is primary. All right, so that's just a little nuance there. The next row has to do with the retiree health plan. So let's say your spouse was a teacher and they had 25 years service and they get this retiree health plan and you're covered on that as well. In that case, if you're turning 65, you have to have your Medicare A and B because retiree health plan would become secondary to Medicare. Right. And the last row of this table is actually one of the more concerning or scary parts of these rules, which we refer to as the COBRA trap. So essentially, when you leave an active employer health plan, as long as it's more than 20 employees, then by federal law, the company has to send you a COBRA offer. COBRA is essentially the same health insurance you have now, but you pay the full premium, and it's generally for 18 months. You can keep that coverage. Well, what's confusing about COBRA is when you're covered, again, you're working past age 65, now you're 67, and your group health plan is paying primary for all your claims, you have no issues. Once you leave active employment, Medicare becomes primary for you. So that last row, COBRA, Medicare is primary. So even though COBRA seems like the same insurance you've had, and it looks like the same insurance, and you're paying a boatload for it, it becomes secondary to Medicare. So you have to have Medicare A and B in place if you're taking COBRA after age 65. All right. If you don't, then the insurance company doesn't have to pay 80% of your claims. You could end up with penalties and delays if you wait too long to enroll in your Medicare coverage. So that's a big issue we see quite often. And something I want you to be aware of: if you're leaving work after age 65, COBRA is very rarely going to make sense. And if it does, you have to have your Medicare in place as your primary coverage. All right. We have a couple of questions that came in. I am still working, and if I want to switch to Medicare, can I do that? And is it cost effective to do that? So that's what I was saying earlier is it could be cost effective. It just depends, right? It depends on how much you're paying out of your paycheck to be covered on the group plan, what the outline of coverage looks like. And then we can help with a comparison to see, does it make sense? Or does it make sense to stay on the group health plan, right? So it's going to depend on how much you're paying and what the coverage is like. And that's certainly something we can help with that comparison. All right, let's go ahead now. Okay, so now you've decided it's time and you're ready to sign up for Medicare. Well, how do you sign up? Well, there's kind of three main scenarios. The first one, if you're turning 65 and you're already enrolled in Social Security benefits, then you're actually going to be auto-enrolled in Medicare A and B. And the government will just mail you your Medicare card about 3 months before your 65th birthday. It's going to be that red, white, and blue card with your name and your Medicare number and your Part A and B effective dates on it. Now, if you don't want the Part B, if you're still covered on a large group plan and you are auto-enrolled because you're taking Social Security, you can just call them up and say, I don't need this, and they'll send you a new card with just the Part A on it and not the Part B, which is the one you pay for, right? The second scenario is if you're turning 65 and you're not enrolled in Social Security benefits, you can enroll the easiest way to enroll is right on the Social Security website, which the link is right here on this slide. It takes about 5 or 10 minutes, and then you get your Medicare card about 3 to 4 weeks later, right? The third scenario on this slide is a little bit more work. So this is for people that are working past the age of 65. Remember I said if you're covered on the Sabre plan, there's not going to be any penalties or delays. Well, the reason there's not going to be penalties or delays is because you have to prove to the government that you are covered on the group health plan when you retire, right? You don't do that now. You do that when you're retiring after age 65. And the way you do that is these two forms is how you sign up. The first one is a simple enrollment in Medicare form that you fill out and sign. It's 1 page, and you put your requested effective date in the remarks section. So January 1st, 2023, or whatever date you're signing up for. And then the right side of the screen is the employment information form. We call it proof of coverage. And that is the really important form that gets filled out by your employer, that shows you've been covered on the group health plan since you were 65. And that second form is how you avoid any penalties or delays in your Medicare coverage. Okay, once you have those forms put together, you got to get those to Social Security. Our recommendation is to physically go down to the Social Security office and drop those forms off. And someone will look at those forms, make sure they look correct, and they'll start the process for that Part B enrollment. All right. It takes about 3 to 4 weeks, and you'll get your new card in the mail at that time. There's also an online portal. If you don't want to go down there, you don't want to fax or mail them in, you could technically upload those forms to this online portal. We've had the greatest success with people that go down to the office and someone looks at those forms, make sure that they look correct. So, but there are other options. Okay, so I'm actually going to be handing it off now, and I didn't actually get a chance to introduce Rod at the beginning. I apologize, Rod. But Rod's one of our superstar agents here at Senior Advisors. He's been with us now a little over 2 years. He's doing a fabulous job, and he's going to take over the presentation here and talk about the differences between Medicare Advantage and Medicare supplements.
Awesome. Thanks so much for the handoff, Justin. Good start. We do have one question. They asked, does after 65 mean after the 7 month window? And the answer is yes, yes. So after 65, after you're out of that initial enrollment period, that's when you would need to show that proof of coverage. You would need to fill out that CMS 40B form, and those two forms would need to be sent to the local Social Security office. So outside of that 7 month window is considered after 65. All right. Good question. All right, so now we're going to get into a little bit of, some of your Medicare choices, right? So once you decide that you're going to enroll in Medicare, you really only have two paths to go down. And as you can see here on this chart, you can either go the Medicare Advantage route or you can go original Medicare with a Medicare supplement. The big thing to remember is you can't do both, right? You cannot have a Medicare Advantage plan and a Medicare supplement plan at the same time. And secondly, what we come across often is, unfortunately, folks not necessarily understanding the difference between these two types of plans, and using the name synonymously, referring to an Advantage plan as a supplement, which, as we'll see here, they're completely different. Um, so what are some of your options, right? Well, if you want to go the Medicare Advantage route, also referred to as Part C, you're going to be enrolled in a HMO or PPO like plan, right? Similar, no doubt, similar to the plan that you have now through Sabre Systems. An HMO being a closed network where you have to go to the doctors in that plan. If you go outside of the plan, you're paying 100% of the cost. PPO, still being a closed network, but you have the opportunity to go outside of that network at a higher cost share, as long as the providers agree to the terms of the plan. So it's managed care, where normally like your primary care physician is going to be overseeing your health care. And oftentimes what we see with these Medicare Advantage plans, or how it works, is they combine all of your A and B benefits, which is your hospital and your medical insurance, and oftentimes your Part D prescription drug coverage. It's all bundled into one, right? So it's a bundled plan for your health care, and it's also managed by the private insurance company. Now, the other route is original Medicare, which is direct care, right? So you have your Part A and your Part B. You sign up for that. You also pick a Part D prescription drug plan, which Justin's going to get into a little bit, and we'll also send some videos out, so you can get a little bit more educated on that. But really, Part D, there's about 25 different plans available in each state, and they're all different. And it's all the one that's most suitable for you is going to be, needs to be compared to your list of medications that you're currently taking, to make sure you have a plan that's going to get you the coverage you need. And then lastly, because Part A and B only cover roughly 80% of your medically necessary services, you have the choice to pick up a Medicare supplement, or what's also referred to as a Medigap plan. So obviously, right, these are two different paths. The Medicare Advantage Part C being, a bundled plan all in one, whereas if you go the original Medicare route, you're picking your own Part D prescription plan, you're picking a Medicare supplement plan of your choice. That's going to help you get 100% coverage for your medically necessary services. So bundled plan and more of an a la carte type of path. And let's see, we have a question. Looks like Justin's answering it. Um, did we answer that? Okay. All right. All right, so we'll go to our next slide here. Just understanding the difference between these two plans. That's what we highlight at the beginning. It's extremely important to understand the difference between these two options, and then really that's how you can make an informed decision. So first and foremost, supplements and advantage plans. How do they relate to Part A and B of Medicare, which is original Medicare? Well, with a supplement, it does exactly what its name implies. It supplements original Medicare. It works alongside your original Medicare coverage to help you be 100% covered. If Medicare pays, your Medicare supplement pays what's left over. As far as Medicare Advantage plans, they actually replace your original Medicare Part A and B benefits. So even though you're still responsible for paying the Part B premium, and the IRMAAs, if you are, assess the IRMAAs, you're actually off of original Medicare and you're in this fully privatized insurance policy that's administered by, the different carriers that are available. And roughly there's about 25 to 30 different Medicare Advantage plans available in each service area. So there's a number of plans out there. So another key difference is in that second line, private networks. With original Medicare and a supplement, you are able to go to any hospital, any provider that participates with the Medicare program. And right now, that's about 99% of hospitals and over 90% of providers. And that's anywhere in the United States of America and its territories, right? So it's not really a private network. It's the Medicare system. It's that federal health insurance program. The difference with an Advantage plan is generally, again, you're going to be on an HMO or a PPO-like plan, where you're going to have to go to the doctors within that network. If you do go outside of the network with a PPO, you just have to ensure that they agree to the specific terms of your plan so that you can get the coverage that you're looking for. So it's a little bit more restrictive in the terms of networks when it comes to Part C. A third point, referrals, right? You want to go see a specialist or you want to have a test done. With original Medicare and a supplement, you do not need a referral to see a specialist. With Advantage plans, they are adding this benefit into a number of the plans, which is great for the beneficiaries that want to go this route of having managed care through a Medicare Advantage plan. But the majority of the plans do have the need for referral. So in order for you to go get a test or in order for you to go to see a specialist, you have to go to your primary and they have to give you a referral or get prior authorization for you to get these services done. So that's a key difference to keep in mind when it comes to the choice that you want to make when it comes to your Medicare. Next, we talked about it briefly on the previous slide, Part D, prescription drug coverage. Original Medicare does not cover prescription drugs, so you have to pick your own Part D prescription plan, which again can be tailored to your specific list of medications. All these plans are different. They have different formularies, different tiers, so you can really fine tune it to find the plan that's going to work best for you. With the Advantage plans, Part D prescription drug coverage is included in the plan. So it's all built into one, not just your hospital, your medical, but oftentimes your prescription drug coverage is also built into it. You cannot have a Medicare Advantage plan and a standalone prescription drug plan. You have to have the Medicare Advantage plan covering your prescription drugs, unless you have coverage either through like the VA or something like that. One thing that a lot of people really focus in on, which is normally why a lot of folks may lean towards a Medicare Advantage, is because the premiums are generally lower, right? As Justin mentioned earlier, oftentimes you're seeing $0 Medicare Advantage plans. They can go all the way up to over $200. Frankly, I wouldn't understand why anyone would go for a $200 Advantage plan, but they do go that high. But oftentimes, what you'll see the advertisements for, what you're seeing in the mail, what people are calling you about are these $0 Advantage plans, because that's normally the premium that you're going to see. Whereas with a Medicare supplement, those premiums are going to be a little bit higher than $0, but the prices range depending on your age. But the flip side of that, right, is with that higher premium, your out-of-pocket costs with a Medicare supplement are minimal, right? So once you pay your premium, we're going to go over 3 of the most popular Medicare supplement plans. And oftentimes your only out-of-pocket is the Part B deductible, which this year is $233. Next year is going down to $226. So you pay $226 after your first or second doctor's visit, and then you have no out-of-pocket costs with the Medicare supplement. You have your premium, and that's it. You're 100% covered for medically necessary services. On the other end, with an Advantage plan, granted, you're not generally going to be paying anything per month, but you do have co-payment and co-insurance all the way up to the federal maximum of $7,550 this year. In 2023, that out-of-pocket maximum goes up to $8,300, as you notice here in the asterisk. All right, and then lastly, which is extremely important, when it comes to this, we refer to choosing your Medicare plans as a lifelong decision or as a lifetime decision, a guaranteed renewability for life. So Medicare supplements are guaranteed renewable for life. So what that means is as long as you stay alive you stay enrolled in the plan, and you continue to pay your monthly premium, no one can ever take your Medicare supplement away. So as long as you, again, stay enrolled in that plan and pay your premium, you're guaranteed renewable for life. With Advantage plans, that's not the case. Every single year during the annual election period, which is right around the corner, starts next week, October 15th through December 7th, there's changes to all of these Medicare Advantage plans. Oftentimes there's changes in formularies, there's changes in the doctors and hospitals that participate with these plans. And as we're seeing this year, some plans are just disappearing altogether. Um, so that guaranteed renewability is not necessarily there with these Advantage plans. It's something that you would have to stay on top of every single year, which can create a little bit more hassle than it needs to be. So those are just some of the key differences that it's important to keep in mind when you're making your choice about which Medicare route you would have to go. Right. So everyone's choice is going to be different: Medicare Supplement or Medicare Advantage. We can help with either decision. Obviously, we do believe that the Medicare Supplement does provide the greater peace of mind and greater access, to the hospitals and providers that you're looking for. But obviously, if the Medicare Advantage is the route you'd like to go, we work closely with helping you find the most suitable one to get you the coverage you need. So we're just going to briefly go over 3 of the most popular Medicare supplements to help you kind of understand more clearly how they actually work, all right, and how they work alongside your original Medicare. So those 3 most popular plans are Plan F, Plan G, and Plan N. All right, Plan F, Plan G, and Plan N. So this is how Plan F, a Plan F Medicare supplement, works alongside original Medicare. This is specifically Part A. So it's your hospital insurance, your inpatient care. So if you only had original Medicare and you go to the hospital, those first 60 days, you would be responsible for the first $1,600, right? That's referred to as the Part A deductible. So if you only had original Medicare, Parts A and B, that's what you'd be responsible for. With a Plan F Medicare supplement, that Part A deductible is covered 100%. And that goes on even if you're in the hospital longer than 60 days. If you're there 61 to 90, it now turns into a $400 daily copayment. If you only had original Medicare, you'd be responsible for that. But with this Plan F Medicare supplement, it's covered 100%. And so as we can see here, just, the bright green far right, really you have no out-of-pocket cost when it comes to a Plan F Medicare supplement. Medicare pays their portion, the Plan F Medicare supplement pays their portion, and you're responsible for nothing. And that also reigns true when it comes to Part B of Medicare, which is everything outside of the hospital. Generally, the first $226 that, generally after your first or second doctor's visit is referred to as the Part B deductible. That's how much you would be responsible for before the plan starts to pay their portion. But if you have a Plan F Medicare supplement, you're covered 100%, even from the deductible. One thing to keep in mind, though, is Plan F, unfortunately, is not available to anyone who was not eligible for Medicare before January 1st, 2020. Now, that doesn't mean you had to be enrolled in Medicare before January 1st, 2020. You just had to be eligible. So basically, your date of birth needs to be 1954 or before, and you could still purchase a Plan F Medicare supplement. Now, one thing to keep in mind before we move on to the next most popular plan, which is Plan G, all of these plans, all Medicare supplements, are federally regulated and standardized. So what that means is that the government actually sets the terms of how all these plans have to operate, and then they just allow these private companies to administer the plans. They're just glorified bill payers. So it does not matter who the carrier is, right? It can be Company A, Company B, or Company C. If they're offering you a Plan F, a Plan G, or a Plan N, they're all going to operate exactly like this screen and these slides show. So you don't have to worry about, this company or that company. If they're offering this Medicare supplement, this is how it has to operate with no changes. All right. So Plan G. Plan G is exactly like Plan F, except when it comes to Part B of Medicare, which is your, outside of the hospital. So Part B, you are for Plan G, you are responsible for the Part B deductible. So that first $226, generally again your first or second doctor's visit, you're responsible for that $226, and then after that, Medicare pays 80%, and then the Plan G Medicare supplement pays the other 20%. So, in essence, you are 100% covered for your medically necessary services, because as long as Medicare pays, your Medicare supplement has to pay. They have no say so when it comes to your care. They cannot deny any claims or anything like that. As long as Medicare pays, your Medicare supplement is required to pay. So it's a really seamless process. The billing is automated, and it's just very easy to use and easy to understand, right? Plan G, you pay your deductible, you pay your premium. After that, you have no more co-pays, no co-insurance, no deductibles for the rest of the year. Now, another popular plan is Plan N, as in Nancy. Plan N is exactly like Plan G, except you do have a little bit more out-of-pocket expenses. With Plan N, on top of being responsible for that Part B deductible, which is $226 starting January 2023, you're also responsible for up to $20 per office visit and up to $50 for emergency room visits. Now, it's worded specifically like that because not every office visit is going to cost you 20 bucks. Some offices won't charge you anything. They'll just bill it to Medicare and take what Medicare pays, and that's it. But they can charge you 5, 10, 15, but the maximum they can charge you is $20 per office visit. And the same is true for emergency room visits. You may not get charged that full $50. It could be anywhere in between, or they won't charge you anything at all. And if you are actually admitted into the hospital, that $50 copayment is waived, so you don't have to worry about it. So, and then lastly, what's referred to as Part B excess charges. This is something that's not very common, but basically, if a provider wants to work with Medicare, generally they agree to what's called assignment. So they agree to the set amount that Medicare approves to pay for every service imaginable. Once a year, though, a provider is able to say, hey, I want to work with Medicare, but I want to charge it a little bit more. So they'll allow that, but the maximum that they're able to charge above that Medicare approved amount is 15%. Those are referred to as excess charges. If your provider charges you excess charges with Plan N, you are responsible for that excess. With Plan G and Plan F, if they were to charge excess charges, they'd be covered 100%. Now, again, it's not very common because providers, they can't pick and choose who they want to assess this charge to. It's really across the board for all of their patients, and it's you would know, right, if you're being charged those excess charges. But that's really the difference between Plan N and Plan G. Usually we'll see a bit lower premium for Plan N because you have a lot more variable cost, right? So you have co-payments, you have to worry about those excess charges. Therefore, the premium is generally lower. But those are the three most popular Medicare supplement plans that are out there. And again, it doesn't matter who the carrier is, as long as they're offering this letter or this plan letter for these plans, they're all going to operate exactly like that. All right. So, when can you actually enroll into one of these Medicare supplements or Medigap plans? Well, the 6-month open enrollment period revolves around when you enroll in Part B. So whether that be when you're turning 65 or it's after 65, you're retiring and you're now signing up for Part B effective December 1st of 2022. Well, from your Part B effective date, you have 6 months to enroll in any Medicare supplement plan that you're eligible for, and you are guaranteed to get that plan. They cannot deny you. You are guaranteed to get accepted. That also applies if, as Justin mentioned, if you're under 65, you've been on Social Security disability, so you're on Medicare before you turn 65. Surrounding your 65th birthday, you have another opportunity to enroll in a Medicare supplement, no questions asked. Now, for a person who's on Social Security disability, this is really the last opportunity they have because after this 6 month window or surrounding your 65th birthday or your Part B effective date, if you wanted to get into a Medicare supplement plan, you would have to go through medical underwriting. So it's a series of health questions where they're looking for serious health conditions, heart attack, stroke, COPD, cancer, all of these things. And depending on how you answer those questions, you could either be accepted or denied. So really, if you wanted to get into a Medicare supplement, most people would do it during this window, right? The 6 month open enrollment surrounding their Part B effective date, or if they've been on Medicare before 65, the 6 month window surrounding their 65th birthday. So those are the opportunities in which you'd be able to get into a supplement. Now, we're going to hand it back over to Justin to get into Part D.
Thanks, Rod. Great job there. We had a couple of questions come in just as you were going. I did answer them in the window, but I'll just quickly read through those for folks. One of the questions is, and we're going to get into Part D right here, do each of the Part D or Part C plans have their own drug formulary, or does the government set it? The plans have their own formulary, so they all set their own formularies. There are certain rules that they have to follow, which we're going to get into here. But as far as the drugs that they cover, they have to cover at least 2 drugs in every therapeutic category. So if you get prescribed something in the middle of the year, there's a high probability it's covered on any of those Part D prescription plans. If for some reason it's not covered, you have 2 options. One, you can go back to the doctor to see if one of those other 2 drugs would work for you. The other option, the doctor can file for an exception to get that other drug approved until you can switch out of your plan into a different plan during that annual election period. So, but that's a very uncommon, because again, they have to cover at least 2 drugs in every therapeutic category. The other question, with original Medicare, since there's no network requirement, do all doctors' offices have to accept or accept Medicare? The answer is no, they don't all accept. I think Rod pointed out pretty much every hospital in the country accepts Medicare, and it's about 90% of doctors. So a very high percentage of doctors accept and participate with original Medicare. Generally, the doctors that don't participate are those that don't take any insurance, right? There's certain, in Manhattan that just specialists that just don't participate with any insurance. That's generally the exception. But again, about 90% do accept Medicare. We got 2 other questions that came in. As opposed to the one plan limited by age, are the other 2 plans available to those just turning 65? Okay, so I think we're referring to the 3 that Rod went through, F, G, and N for the Medicare supplements. The F is the plan that's you have to be 65 prior to January 1st of 2020 in order to qualify. But the G and the N, there's no age qualification. Anyone turning 65 can get G or N. Someone asks, what is the premium for plan F, G, and N? Well, it varies by a number of factors: zip code, age, sex, male, female. Let's see here. Underwriting could affect the pricing as well. So it's really going to vary dramatically, and by state. I'll tell you, in New Jersey, for example, age 65 male plan G might be approximately $150 or $160 a month. Female might be roughly $130 a month. They tend to be a little bit less expensive than the male rates, but it's going to go up. In most states, it's age-based pricing, so it will go up with age. New York, for example, happens to be community rated, which means everyone pays the same rate, but it's a lot more expensive. It's like $280 a month for the plan G in New York, for example. So that just gives you a rough idea, but again, it's going to vary just depending on your situation. All right. I think those are the questions we have. Again, keep firing them away. If you have more questions, feel free to type those in the Q&A. But we're going to get into the prescription drug coverage now. If you could jump to the next slide, actually, we'll start with, So this slide shows the framework for all, there's like 25 different drug plans available in each state. They all have to follow these rules. So there's kind of these 4 different steps within Part D of Medicare. The first one is the deductible. And these drug plans can have a deductible up to $505 next year. All right, so it can be 0, it can be 200, but it can't be any higher than $505. If your plan has a deductible, it generally only applies to the higher tier medications. So if you're just taking a low cost generic blood pressure med, you might have a 0 copay or $1 or $2 a month, even if your plan has a deductible, because it only applies to those higher tier drugs. If you do have a higher tier drug and you have a deductible, then you're going to pay the full cost of that drug until you reach the deductible. And then you fall into the second step, which is called initial coverage. And this is where you're going to pay a copay or coinsurance for your medication. It's going to feel similar to most employer plans or individual under 65 when you have a $5 copay, 10, 40, whatever your copay is for that medication, you're going to pay that in step 2. And 85% of Medicare beneficiaries are not going to get past step 2 of this diagram, which means they have relatively inexpensive medications. As long as they're below this threshold of $4,660 based on the retail cost of the medication. So it's not the amount you've spent for your medication, but the full retail cost. If your drugs are less than that number, you're never going past step 2. However, if you have very expensive medications that exceeds this initial coverage level, then you're going to fall into this step 3, which is also known as it's called the coverage gap. It used to be referred to more as the donut hole with Part D of Medicare, where you have to pay 25%. You see at the bottom there, 25% the cost of the drugs. So I give an example just to help illustrate this because it's very confusing. But for simplicity, let's just say you're taking one medication and it happens to be very expensive, which again is only about 15% of Medicare beneficiaries that have these expensive meds. But that's Xarelto, which is a common heart medication. It's about $600 a month in retail cost. So if that's your only medication and you go to, let's say your plan doesn't have a deductible and you go to pick up that medication in January, and let's say your plan has a copay of $45 for that Xarelto. You pick it up for $45. February, it's $45. March, April, May, June, you get all the way through the year, and it's all $45. And then you get to September, and you go to pick up that same medication, and now the pharmacist says that'll be $150. And you say, I'm sorry, that's got to be a mistake. It's a $45 copay. Well, what happened there? Well, you're now 9 months into the year, and you've consumed the Xarelto for the 8 months times $600 a month retail. Doesn't mean you spent $600 a month, but that's the cost of that drug times 8 months is $4,800 roughly. So now you're past that initial coverage level of $4,660, and you're in September, and you go to pick up the medication, and you've got to pay 25% because you're now in step 3, the coverage gap. And that's why you're paying $150 because 25% of the $600 is $150. So instead of that $45 copay, now your cost just went up and you're paying that the rest of the year. All right. Now, the other step here, the catastrophic coverage, this is a very small, only about 4% of beneficiaries reach all the way to catastrophic coverage. And this is if you have very expensive medications. It's kind of the other side of the donut hole. It's there to protect you so you're not stuck paying that 25% the entire back half of the year if you have a very expensive medication like a Humira. Humira is like $6,000 a month retail cost, right? So if you were in the donut hole paying 25%, that's still $1,500 a month you'd have to pay for that medication. And so the catastrophic coverage is there so you're not paying that every month. Eventually, it'll take you about 2 months or so of paying that $1,500 to hit the catastrophic, where you start to pay 5% instead of the 25%. All right. So I know it's very confusing. What I tell people, rather than getting caught in these numbers, because it's apples and oranges, it's $4,660 retail cost to get into the coverage gap, and it's $7,400. It's called true out-of-pocket cost, which is a completely different metric to get out into catastrophic coverage. What I tell people is, look, if you have very expensive meds, you're probably going to spend about $1,500 of your dollars to get into the coverage gap, and probably another $1,500 or so to get out into the catastrophic, where you're paying 5% of the cost of the drugs. All right. So that's the framework of how these drug plans work. Again, there's about 25 different drug plans. They all have to follow these rules. So regardless of which of those plans you pick, you're going to have that donut hole and the catastrophic and so forth. All right. Now let's go back one, Rod. So now there was a bill that was passed back in August, and this bill has a number of provisions related to Medicare drug pricing. And I just want to touch on some of these in kind of chronological order for when they're going to take effect, which you'll see on this slide. The first changes are coming next year are there's a $35 a month insulin cap. That actually was kind of already in place. There was an executive order signed a few years ago. It was called the Senior Savings Model, which limited a lot of insulins to $35 a month on Medicare. This just puts it into legislation. So now any insulin that's covered on the drug plans will be capped up to $35. So the second item starting next year is the vaccine cost sharing will be $0. This already took effect for most vaccines are covered under Part B as in boy. So like a flu shot, COVID shot, and generally are zero copay. But the one shot that was under Part D as in drugs that we see often is shingles, which generally was a higher tier drug, which went towards a deductible. So for a lot of people, it was $150 roughly for that shot. So starting in 2023, any CDC recommended vaccine will essentially be zero copay starting next year. So 2024, there's some changes coming to these benefit levels and the premium stabilization. So the monthly premium for these drug plans can increase no more than 6% starting in 2024. So that's the premium stabilization. So there can't be significant jumps. This year, for example, 2023, we just got the rates earlier this week. Some of the carriers are doubling, or 60% or 70% increases on these drug plan premiums. So starting in 2024, the most they can increase would be 6%. We're going to go through the benefit levels that I just went through for 2023. Those are changing dramatically in 24, or changing a little bit in 24 and dramatically in 25. There's going to be a maximum out of pocket on drug coverage, which is not there today, which is a positive thing. And then a monthly maximum out of pocket as well, where you can kind of blend those costs so it's not like heavily weighted in the beginning of the year. And then the drug price negotiation, that was one of the big things in the bill. They're going to start that process very soon, but the actual pricing for those drugs, then we'll start to see the lower pricing won't start until 2026. Okay, so those are kind of the key highlights as it relates to Medicare drug pricing for that bill that was passed a little over a month ago. Let's jump ahead now to the benefit chart for 24. So let's talk about those changes. So we don't have this chart we just went through for 2023. I'm not going to go through it in detail again because it's almost identical for 24. We don't know the numbers yet for the deductible, initial coverage, and so forth. But the one change at the bottom right, you can see here, if you reach catastrophic coverage in 2023, you're still paying that 5%, right? That goes on indefinitely. There's no maximum in 2023. But starting in 2024, once you reach catastrophic coverage, which again is a very small percentage, only about 4% of people, they're going to pay $0 for their drugs. All right. So that's the one change in 24. In 2025, it changes dramatically. And essentially the third and fourth steps go away. There's no more donut hole. There's no more catastrophic coverage. And you still have the deductible and the initial coverage level where you're paying copays or coinsurance. But once you reach $2,000 of your drug spend, you're done. Everything's covered at that point. No additional cost for your drugs after that 2,000 number. And that 2,000 number will be adjusted for inflation, ironically enough, starting in 2026. So the 2,000 number will go up, but there will be a cap at least, so you're not unlimitedly exposed for the drug pricing. All right. So those are some of those key changes. This chart here was from the Kaiser Family Foundation, but it basically looked at that bill that we just went through and broke it out year by year. What I just want to highlight here is the drug pricing negotiation, like I said earlier, is going to start really seeing the price drop starting in 26. And then, they're going to add more, like 10 of the most expensive drugs in 2026. and then it goes 15 and 27, and they add more drugs in subsequent years for the price negotiation. Let's go to the next one. These are just the top drugs we see today under Part D as in drug, as far as the most expensive for Medicare. So these are most likely, we don't know for sure yet, but these are most likely going to be some of those drugs that they're targeting for the negotiation. We see very commonly Eliquis, Januvia, Xarelto. I mentioned those earlier, but these are very common expensive medications we see that don't have a generic alternative. Let's go to the next one. And these are the Part B drugs that are covered today that are going to be potentially be negotiated, right? These are the most expensive Part B. Part B drugs are generally administered by the doctor, infusion therapies, chemotherapies through an infusion center. That's most of the things that you see under Part B, as in boy. All right. Okay, so we do have a demo that we normally do for the Part D drug plans. There's a tool on Medicare's website. It's called the Medicare Plan Finder tool. And it allows you to basically enter in all your medication information and dosage and frequency. And then it basically looks at all 25 of those drug plans, and it calculates the total overall expense for the year, which is the premium plus the cost of your drugs for each of those 25 plans. And then it sorts the list based upon the lowest total cost for the year. And generally the one at the top, one or two in the list is probably going to be the best drug plan for you for that year. That's something we do for all of our clients when they first sign up. And then we do it every year during this period when they can change, right? October 15th to December 7th. We send out reminders in September to all of our clients to get their latest drug list and rerun their drug analysis to make sure they have the right drug plan for the following year. We're not going to do the demo today for a couple reasons. Mainly, the government just released the new site October 1st with the new rates, and there's still a little bit of issues in there, a little bit of slowness with the site. So we do have a video, though, that we'll send out at the end of this presentation. So everyone's going to get a link to a few different videos. One of them will be how to do the drug plan analysis. So you'll see that tool and how it works in one of those videos that we do send out. All right. There's a couple other things to mention as it relates to drug costs. These are kind of discount programs. This is not Part D. Like you have to have, if you're on Medicare, you have to have a Part D drug plan. Otherwise, the government will charge a penalty. It's a 1% penalty for every month that you don't have a Part D drug plan. So if you retire and then you decide, I'm not taking any meds, I'm not going to go on Part D, and you wait 3-4 years, and then you decide you want a drug plan, you're going to pay a 36 or 48% penalty on your Part D premiums for the rest of your life. So we highly recommend, even if you're not taking any meds, at least to get the lowest cost plan, which this year is like $6 a month. So you've got some level of drug coverage, and also you avoid that penalty in the future. But these prescription discount programs do not replace the Part D, but they can supplement it. There's certain medications that, for whatever reason, are very expensive on the Part D drug plans that you might find a lower price with a coupon from a GoodRx or one of these other websites. Some of the common things we see are certain lotions and creams that are prescriptions that are expensive on the Part D drug plan. And there's just other medications as well that just are, you can get a coupon for some of those cheaper than what you pay on the copay for your plan. And then at the bottom here, New Jersey PAD and Senior Gold. PAD is prescription assistance for the aged and disabled, and every state has these prescription assistance programs. These are the New Jersey specific ones, and they're based on income. So in New Jersey, it's roughly like $40,000 for a single person. If you're below that income, you would qualify. I think it's $46,000 roughly for a married couple. And if you qualify for PAD, they'll basically pay your premium, and your drug costs will just be $5 for generic, $8 for brand name drugs. It's a very helpful program if you're in a lower income bracket and you have expensive drugs. Those are good programs. Senior Gold is the next step up, where you're making a little bit more than PAD in income. They're not going to pay your premium, and you're just going to have some kind of discounts, and they'll cap your drug costs with the Senior Gold. So it's a little bit different than PAD, but it still can be helpful. All right, we got a couple other questions that came in. After choosing to go with Medicare Advantage, can I, in a later year, switch to Original Medicare? Okay, so Rod went over the differences between Medicare Advantage and Medicare supplements. And they're two very different types of coverage. When you first go on Medicare, Rod mentioned Medicare Part B, there's a 6-month period where you can get any Medicare supplement you want with no medical questions. Okay, so that period is when you're guaranteed to get whatever supplement you want. After that 6-month period, if you want to get into a Medicare supplement, you have to go through medical underwriting. So if you went with a Medicare Advantage plan for a few years, and then you decided that you wanted to get into a Medicare supplement, you were diagnosed with something or whatever, you weren't happy with the Advantage plan, that's the point you probably won't be able to get into a supplement because of the medical underwriting. So each carrier has about 10 to 12 different knockout questions. If any one of those is a yes, they won't even take an application for the supplement. So if you're healthy and you don't have any of the medical conditions, then you would be able to get in, but you'd have to go through that underwriting process. The other question that I think I just clicked it, so I lost it, but something about prescription coverage with TRICARE. Generally, like the VA prescription coverage benefit is a good benefit, and it is credible. So you don't have to have the Part D coverage if you have the VA prescription benefits. And again, it's generally pretty solid, very low cost, if any cost for your drugs, if you have that. So. Okay, we're going to keep rolling here. We're almost done. We're going to wrap up with a recap of the top 5 mistakes people make on Medicare. So hopefully you can avoid these mistakes. The first one is not enrolling in Medicare Part B on time. So this can be, if you don't have the employer coverage and you don't enroll during that initial enrollment period, that's when you'll have those delays and penalties in your coverage. But it could also be the opposite. Some people don't realize this and they think they have to sign up, and they're still working past 65 and they're covered on a large group health plan, and they sign up for their Part B and they're paying Part B, and they might even be in a higher income bracket and they're paying IRMAAs, right? And they're years and years of paying the government all these extra premiums that you don't need because you are covered on the large group health plan. So we see this kind of both ways, people enrolling too soon or too late in the Part B. We also have that COBRA trap that I mentioned earlier, which can really result in delays with your Part B and penalties as well. If you take COBRA coverage after age 65 and you don't sign up for Medicare, you most likely will have delays and penalties in your Medicare coverage. So that's the first biggest mistake we see people make on Medicare. The second biggest mistake we see people make is not analyzing their prescription drug costs. So the difference between the kind of the best plan for an individual and the worst plan, if they have expensive medications, it could be thousands of dollars a year difference in cost. So we highly recommend reviewing this, using that tool I mentioned on the Medicare website. The Medicare Plan Finder does that analysis for us. Again, it's something we do for our clients when they first go on, but then also every year you get that opportunity. Even if your drugs don't change, these drug plans do change every year. And if you don't review it during that annual enrollment period, you could be stuck with the drug plan that you don't want for the entire year, and because you didn't review it because your drugs didn't change. For example, there's an expensive drug this year that a lot of carriers moved from a tier 3 to a tier 4, which significantly changes the cost of the plan for the individual, even though their drug didn't change, and it was Eliquis. Because it got bumped to a tier 4, their cost might have gone up $1,500, right, for the year. So if they didn't review this and look for a different plan, they're going to be stuck paying that higher amount. So that's the second biggest mistake we see people make. The third biggest mistake we see people make on Medicare is not understanding the differences between Medicare Advantage and Medicare supplements. So these are two very different types of coverage. Remember that the Medicare Advantage is the fully privatized plan where the insurance company takes over and fully manages your benefits for you. It's like a managed care program, where original Medicare with a supplement, there's no network. You go to any Medicare participating provider, there's no referrals. If Medicare approves it, which it pretty much approves anything medically necessary, the supplemental has to pay its portion. Two very different types of coverage. Rod went through all the differences. I'm not going to rehash them all here, but This is the third biggest mistake we see people make, is not understanding the differences between these two paths. And the fourth biggest mistake, and this is, really for people that only have a retiree health plan benefit. So, if you worked for a teacher, again, for 25 years, or you might pay $0 a month for your retiree plan, and it's probably the best option for you because you're paying $0 a month and you're getting health benefits. However, if you were a teacher for 20 years, for example, that same retiree health benefit might be $400 plus a month, where you could go out on your own and get a supplement and a drug plan for maybe $200 a month, and it'd be much better coverage. But a lot of people don't think that. They think it's a retiree benefit and they just take it, even though it costs them a lot more than going out on their own. So that's really the fourth mistake, biggest mistake we see. And then the fifth biggest mistake we see people make on Medicare is listening to your friends and family. And we joke about this a lot, but we see it all the time. Really, we see it with like the drug cards, where someone calls up and they say, I want such and such drug plan because my spouse has it, my neighbor has it, my cousin, whatever. And we say, are you taking the same medications as your spouse or your neighbor? And no, I'm not. Well, then it might not be the right drug card for you, right? It's all very specific. Medicare's individual coverage. So you really want to pick the right coverage for your situation. I would add to this slide, listening to the TV commercials as well would be a mistake. The Joe Namath and the William Shatners and all those guys on the TV commercials. Most of those are very misleading, and they're really talking a lot about those Medicare Advantage plans, which can offer extra benefits like rides to the doctors or meals after a hospitalization or dental, cleanings. Those things can be added into those Medicare Advantage plans. And when they run those commercials, that's what they're really focusing on, not the medical coverage, which is significantly different than original Medicare. So that's the fifth biggest mistake we see people make on Medicare. And that is our presentation for today. I'll wait for more questions to come in as I kind of just cap us off here with the presentation. I mentioned this at the beginning. Someone asked the question, what are your fees for this great service? And I didn't plant that question, I promise. Our standard fee is $1 million. So we will send the invoice after our first phone call. Of course, I'm kidding. There is no fee. Like I said at the beginning, we're basically a broker. So we will help you, guide you through the process, answer your questions. If it's not the right time to sign up, we'll tell you it's not the right time to sign up. And essentially, when it is the right time, we'll help you with the process, help you enroll. The way we get paid, we get compensated by the carriers as a broker. So we do get a commission from the insurance company for helping you enroll in whatever plan you decide to enroll into. You pay the same premium whether you go directly to the insurance company or if you work through a broker. So there's really no cost to you. And again, we do that free annual review for the drug plan every year to make sure you have the right drug plan for the following year. We did get another question come in. Can you talk about Medicare and HSAs? So there's a whole nother hour presentation on that. I'm just kidding, but it can get kind of complicated. But here's what I'll say. If you are enrolled in Medicare, A or B of Medicare, you can no longer contribute to an HSA health savings account. Okay. So we get the question a lot. If someone is working past the age of 65 and they're on the company health plan and they like the plan, and it happens to be an HSA or a high deductible health plan with an HSA health savings account, should I sign up for Medicare Part A? Right? Because it's premium free, right? Hospital coverage. Everyone tells me I got to do something at 65. I'm going to be penalized. So I'm going to sign up for Part A. Well, if you do that, you can no longer contribute to your health savings account and get the tax benefit of contributing to your HSA. All right. So we don't always say you should sign up for Part A if you're still working, because that's the downside, right? If you don't have a high deductible plan, or you don't have an HSA, or you don't think you're ever going to have one, and you're turning 65 still working, you can sign up for A if you want. But if you are working and you're going to do an HSA, or you may do an HSA in the future, you shouldn't sign up for Part A, because then you can't contribute to that HSA. So I hope that helps your question, Beth, on the HSA. Please review key points to know with delaying enrollment when working beyond 65. Well, it's kind of what we mentioned earlier. When you're working past 65, you don't really have to do, if you're covered on the large group plan and it's more than 20 employees, you don't have to do anything with Medicare if you don't want. It's optional if you want to sign up for Part A. But like I said, if you have an HSA or are thinking about contributing to an HSA, you can't do that if you enroll in Part A. Really, so that's really all you're looking at. And then the other thing to look at just at a higher level is that comparison I mentioned earlier, is how much am I paying for this group health plan? Or my spouse, maybe I'm paying a lot for my dependent who's turning 65, right? Can I save money by taking them off my group plan, get more money in my paycheck, and maybe I'll save money putting them on Medicare and getting them better coverage, right? Or pay the same amount and get them better coverage. So, that's kind of a comparison we can help with. But outside of that, if you're going to stay on the group health plan, you don't have to do anything with Medicare. So we'll give it another minute here, see if any other questions come in. I'll do a little virtual high five with Rod. Good job, Rod.
Good job, Justin.
Thanks, buddy.
Yeah.
All right, I don't see any other questions coming in, so we are going to wrap this up. Thank you, everyone, for joining today. And like I said, look out for that email summary. We'll send out a few items with the slides and a few other videos. Subscribe to us on YouTube. That's where all of our latest videos come out with Medicare and all of our latest updates. I highly recommend